I want you to try and think of a sport that doesn't require any of your lower extremities to be used. Lower extremity includes your hip, glutes, hamstrings, quads, knee, your entire lower leg, ankle, and foot. It's hard, right? Well, it seems appropriate then that over the span of 16 years, the NCAA recorded more than half of the injuries that were reported were injuries to the lower extremity. If you've ever had an injury before, you know it's not a quick, easy, or cheap thing to fix. In fact, in the US, lower extremity injuries can cost upwards of $50,000 per injury, and that's just for the short-term costs. What about the long-term costs? If an injury is severe enough to affect someone for countless years after, those costs could skyrocket. Functional testing has been shown to be one method in determining the level of risk an athlete may be at for sustaining a lower extremity injury. There are many functional tests out currently that have data to support their use. However, there are two newer functional tests that have limited data. My research is on those two new tests, single leg hip bridge and single leg wall sit. These two tests put individuals in positions where their lower extremity muscles, ligaments, and tendons are highly stressed, and we measure the testing outcomes. The single leg hip bridge measures how many repetitions one can perform of a bridge until they are fatigued. The single leg wall sit measures how long one can hold that position until proper form is lost. There is current evidence that supports that previous injury is one of the strongest risk factors for future injury. My research will not only compile normative data for these two tests, but it will also see if there is any association between previous injury and the test scores compiled. Ultimately, these two tests can be used in an athlete's pre-participation exam to help identify those who are at a higher risk for sustaining a lower extremity injury. By pre-screening these athletes with these tests, we can help lessen the healthcare economic burden and allow healthcare providers such as athletic trainers, physical therapists, and physicians to implement intervention strategies to help decrease the rate of future lower extremity injuries. Thank you.
Thank you very much.